Magandang araw po muli. Pagpapatuloy po natin ang ating pag-aaral sa blood, number 16. So, blood stasis. Ito po yung mararamdaman natin. Stabbing, fixed or boring pain. Dark complexion. Makikita natin sa kanila. Yung purple lips, purple nail. Bleeding with dark blood and dark clot. Dark menstrual blood with dark clot. Purple tongue. Wiry, choppy or firm pulse. Pattern of identification. So kung titingnan po natin yung tongue, body is purple bluish. Tapos may dark blue or purple spot po tayong makikita. Yung dark, crook or elongated and thick sublingual vein. Pag pinabaliktad po natin yung dila, makikita natin sa ilalim. So indication po yun ng blood stasis. Ayan po, nakikita natin ano. Purple bluish color or dark spot on the side of the tongue indicates blood stasis in the liver. So, yung pagdalawang gilid po liver yan. On the tip, sa heart po yan. Sa center, stomach. Makita natin yung mga purple color. So, yung pulse po, classic pulse is unsmooth and tight or choppy. Thin and rough with irregular rhythm. Like scrapping bimbo, surface slightly with a knife. Ayan po nakita nyo yung yung guhit-guhit na yan. So ang nararamdaman natin pag full yung niya, yung nakakarating doon normal. Pero yan po pag diniinan mo po yung pulse, mayroon mamaya naman wala. So ganun po yung rhythm niya irregular. So magcha-choppy. So pag blood stasis in the liver po, wiry or firm pulse, yan po yung mga nararamdaman Pag wiry po yan, para siyang gitara na nararamdaman po natin. Then, yung lakas po niya, forceful, light, medium, or heavy. So, pag forceful, pag ginanon po ninyo yung kamay, ipinatong nyo sa kamay, ay sa pulsuhan, mararamdaman po ninyo na parang may tumutulak sa fingers. So, pag distal, middle, proximal naman po, yung long na category, ayan po yung mararamdaman. Meron din pong parang flat shape na pag pinatong po nyo yung kamay, halos hindi mararamdaman. So, yun po yung mga ng blood stasis. Blood stasis in heart. Pag heart pang may problema, choppy po or knotted pulse ang ating mararamdaman. Yan, parang putol-putol. So, blood stasis due to deficiency pattern. Deep. Kailangan mo pong diinan ang pagpatong mo ng fingers mo dun sa pulsuhan. So, sa ilalim po nyo mararamdaman. Weak and choppy pulse. Pag may masses or tumors naman po, ito po ay result of blood stasis and or phlegm accumulation. So, larger or firmer fixed masses or tumors are associated with blood stasis, intra-abdominal masses. Sa Western laboratory findings po, increase or decrease in hematocrit or packed cell volume. Increase din po or decrease ang red blood cell count. Increase or decrease in platelet counts. Increase in albumin or total protein. Increase in cholesterol or triglycerides. Ibig sabihin po nun, hindi normal yung nakukuha sa laboratory. Food therapy po for blood stasis. So, aims to increase food that promote circulation to remove blood stasis. To avoid food that can impair circulation. Bawal po yung mga cold foods kasi lalong magkakaroon ng blood stasis. So, kailangan po yung warm food. Halimbawa, shrimps, oat, mustard leaf, peach, hawthorn, fruit, chestnut, vinegar, ginseng, black pepper, and turmeric. So, yung cool food naman po, tulad ng crab, mung bean, asparagus, eggplant, kale, celery, banana. So, maganda po yan. Yung neutral food naman po, ito yung mga black fungus, yung wood ear mushroom. Taingang daga po sa Tagalog yan Tapos yung mga potato, shiitake, kidney bean. Okay po siya. So, thank you po.
Thank you very much, Ma'am Mildred. Next, we have blood tongue diagnosis. Let's welcome Ma'am Teresita Sumile. Wait lang po. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Welcome po sa tongue diagnosis, and now let's talk about characteristics of yin-deficient tongues. Everyone possesses a basic constitution that shapes and influences that individual. Assessing a patient's constitution is based on knowledge of patients' previous illnesses and their course of development, as well as on observing the individual's being or rhythm of life. The constitution is also reflected in the face, pulse qualities, tongue. In a person with a young constitution, the tongue is reddish, long, big, white. With a yin constitution, the tongue body tends to be pale and swollen. It is therefore sensible to take note of the tongue, especially its shape and consistency when evaluating an individual's constitution. Okay? The kidneys house both yin and yang. Yin manifests in the body tongue through the fluids, substance, and structural elements. Pure fluids and blood belong to the domain of yin. Yin nourishes and moistens all tissues of the body. Each of the yin organs controls and preserves specific aspects of yin. Nutritive qi, which nourishes the 5 yin organs and moistens the 6 yang organs, has its root in the spleen. Blood is stored in the liver and produced by the heart. The lungs distribute fluids, which originate in the spleen and kidneys, and nourish the skin and hair. However, the body's yin is rooted in the kidneys. Cool in nature, yin controls and prevents the pathological ascension of yang. It also limits the rapid buildup of heat. Together with the blood, yin anchors the spirit, which leads to good sleep and a balanced mind. Yin and essence nourish each other and are mutually dependent, especially in maintaining body structures and quality of the fluids. The fluids and blood are yin in nature. Together, they supply the tongue with sufficient substantive energy so that the tongue body achieves its normal volume, elasticity or softness, reddish color, and moisture. An excess of yin in the form of dampness, for example, leads to a swollen tongue body. Qi governs movement of blood and fluids and transports them to the tongue. Thus, tongue body color, shape, and moisture always reflect the condition of qi and yin in each of the yin organs. Yin deficiency has characteristic tongue signs, which are red tip, cracks in tongue body, red, dry, stiff, or in severe cases, even shrunken tongue body. Okay, so this is the picture of a tongue with yin deficiency. It is red, it has red tip, cracks in the tongue body, red, dry, and stiff. Okay, yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. We will now proceed to pulse diagnosis and to diagnosis by interrogation. Sorry. And we will call on Ma'am Vina Pasqua of Baguio. Good afternoon, Ma'am Vina.
Good afternoon po, Doctor. Good afternoon po sa lahat. So, mental emotional symptoms, day 14 po tayo. At ang topic natin ngayon ay mental restlessness. Itong mental restlessness, ito yung pagkabalisa o kaya ay hindi mapalagay. So, mental restlessness is a translation of the term, check po, panzao, which literally means vexation and restlessness. It also includes restless legs. Ang term po na panzao encompasses two different symptoms. Yung fan fixation is due to full heat and pertains to the lungs. And zao naman is restlessness. It is due to empty heat and pertains to the kidneys. Fan is yang, and zao is yin. A patient is unlikely to use the term mental restlessness, but may describe having difficulty in concentration. So, hindi siya maka-focus on one thing for any length of time. Or not being able to sit still and do nothing. So, balisa sila or hindi mapalagay. Yin deficiency with empty heat may cause a vague feeling of mental restlessness, which worsens sa gabi, while phlegm heat naman in the stomach and or heart, okay, heart fire will cause a more intense feeling, which may be accompanied by mental confusion. Mental restlessness also, maaring sanhi rin po ito ng lung heat, in which case it will be accompanied by worry and other lung symptoms such as yung parang hindi makahinga o kaya may ubo. So ito po yung summary. Mental restlessness, yin deficiency with empty heat, nakakaramdam po ng vague mental restlessness, restless legs, red thumb with coating, including empty rapid pulse. Pag phlegm heat naman sa stomach at saka sa puso, mental restlessness, mental confusion, agitation, rash behavior, tendency to hit or scold people, shouting, depression, manic behavior, tongue red in the center with a sticky yellow coating, at saka merong stomach heart crack with a rough sticky yellow coating sa loob niya. So ito ay slippery rapid pulse. Pag heart fire naman, pronounced mental restlessness, agitation, pula po yung dila pero mas pula sa tip and yellow coating. Overflowing po ang rapid ang pulso. Pag lung heat, mental restlessness, worry, red tongue with yellow coating. At ang pulso po ay overflowing rapid. So yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. Let's now proceed to pulse diagnosis. And let's welcome once again Ma'am Mildred Digma.
Magandang
po ulit, Ma'am Mildred.
Magandang araw po muli. Pagpapatuloy muli natin ang ating pag-aaral sa pulse diagnosis. 97 irregular pulses. Irregular pulses. The three irregular pulses are the knotted, intermittent, and skipping. All three of these pulses miss beats. So, hindi yan yung normal talagang nararamdaman. The difference between the three lies in their overall speed and whether they are irregular or regular, in which beats they skip. When the pulse is very irregular, it can be difficult to assess how rapid the pulse really is. This is because if the pulse skips a lot of beats, it is difficult to estimate how many beats per minute there otherwise would have been. Kasi akala natin tapos na, yung pala nagbibit pa. Yung mahirap po pag nagpa-pulse tayo ng irregular. An irregular pulse is always indicative of a heart imbalance, both in Western medicine and Chinese medicine sense. Kasi nga po yung heartbeat natin nakakonect sa heart. Yung pulse. knotted pulse. So this is sometimes also translated as a bound pulse. The knotted pulse is slow and irregular in its rhythm. It is randomly misses beats. Then the reason for its missing beats and its slowness is because there is something, maaari pong may phlegm or may cold or may blood stagnation or pwede rin may food stagnation, for example, inhibiting the heart from circulating blood through the channel in vessel. So nababara-bara kaya hindi po normal yung pagpitik ng pulso. Or because dahil yung puso po ay mahina or heart yang are too weak to perform their function. In the former, the pulse will also be forceful, whereas it will lack strength in a deficient condition. So yung natin pwedeng deficient or excess. So knotted pulse, pattern of imbalance, pwede po siyang dahil sa may chi stagnation or may blood stagnation, may phlegm stagnation, food stagnation, heart chi deficiency or heart yang deficiency. So yung typical combination po niyan, knotted and forceful. So parang yun, putol-putol pero malakas nararamdaman. Chi stagnation po yan or may blood stagnation. Phlegm or food stagnation. So mga excess condition po siya, no? Knotted and without strength. O mga deficiency condition naman to. Heart chi deficiency or heart yang deficiency. Pag intermittent pulse naman po, hindi po tutulad dun sa knotted pulse. Pag intermittent pulse po, regularly interrupted. Pulse is regular in terms of its beats, it is skipped. After it has skipped a bit, it will feel like a pulse wait momentarily before it starts beating again. So this is because chi is so weak that is unable to keep blood in motion, and the body must gain strength before it can move the blood again. So it may be necessary to feel the pulse for a long time before it skips a bit, perhaps as many as 50 beats. So yung intermittent pulse po ay maaari po siyang dahil sa deficient condition ng puso or more of the other sang organs. Intermittent pulse, pattern of imbalances, karaniwan po yan ay ang may problema ay yung mga sang organs deficient. Pag skipping pulse naman po, so skipping pulse is also termed hasty in some books. So ito pong pulsong ito ay rapid pero irregular. So randomly, nagkakaroon po siya ng skip beats. The skipping pulse can arise when internal heat overactivates the heart. It is if the heart beats so fast that the pulse cannot keep pace. Yang Qi has become more powerful than Yin, can control and harmonize. So this means that Qi separates from blood and races ahead. The heat can also create stagnation of blood or phlegm, which then block the flow of blood in the vessel. Yung heat po usually exists in nature. At dahil po ito sa factor ng mga Shi-Qi o yung dahilan ng mga pagkakasakit, pathogenic factor, or stagnation of Qi o dahil sa blood, phlegm or food, or heat from other organ. So these pulse image can also arise in extreme and severe condition where yin and yang are beginning to separate from each other. In this case, the pulse will be very frail. Skipping pulse, pattern of imbalance, heat. Pag may skipping pulse po ay heat. So ito yung typical combination po niyan. Skipping in forceful, excess heat po yan. Skipping in without strength, extreme yin deficiency. Thank you po.
Thank you very much, Mildred. We will now go to differential diagnosis. I hope the signal is Okay, Ma'am Neets. Okay na siguro.
Hello, Doc.
Yeah, let's
Good
welcome
afternoon.
Ma'am Neets.
Sana di mawala net.
Okay po.
Welcome to our DCM Foundations number 198. Dito na tayo sa small intestine pattern. Full heat in the okay. Slide please. So, etiology, dahilan ay emotional problem or yung prolonged anxiety, stress, anger, depression. Always on the go. Parating gusto maalis. Excessive mental activity. Okay? Underlying and or accompanying pathology, stagnation of liver chi stagnation in the lung, heart chi stagnation, heart fire blazing, damp heat in the bladder. Possible presenting condition ay yung UTI, yung urinary tract infection. Signs and symptoms, mental restlessness, tinnitus, sore throat, tongue ulcers, discomfort and heat in the chest, abdominal pain, thirst, scanty and dark urine, painful urination, blood in urine, typical na UTI. Pulse when you palpate is rapid and overflowing, especially in the front left position. Okay. Tongue when you observe the tongue, it's red with reddened swollen tip. May yellow coating din. Okay. Treatment principle, clear the heart and drain fire in the small intestine, stop abdominal pain, calm the shen, supplement the yin to clear heat. Okay. Acupuncture treatment points, SI2, small intestine 2 clears small intestine heat. SI3, small intestine 3 clears interior heat. Spleen 9 clears heat from lower burner. Heart 5 clears heart fire. Stomach 39, the lower C point for small intestine, it stops abdominal pain. SI5 clears heat and calms the mind. REN 3, this inhibits the bladder. REN 4, regulates G in the lower burner. And Heart 8, clears heart fire. So, technique for the needling is with drainage. Okay po. I hope you learn po. Thank you very much, Doc. Hello.
Thank you very much.
Thank you po.
Thank you very much, Ma'am Neets. Next, we go to acupuncture patterns and practice. We will take up jaundice. Jaundice is a common medical condition characterized by yellowing of the skin, the eyes, and the urine. It results when turbid dampness causes dysfunction of the liver, the gallbladder, the spleen, and the stomach, so that the gallbladder is unable to discharge bile normally. As a result, bile extravasates from its normal channel. Etiology and pathology of jaundice. In general, jaundice may result from exogenous as well as endogenous causes, often both. The most common exogenous pathogenic evil is turbid dampness, which may be accompanied by cold or cold dampness or heat dampness. Among endogenous causes, the most common cause is disease of the spleen and stomach, extending to involve the liver and the gallbladder. The basic pathological mechanism is blockage by turbid dampness, so that bile cannot follow its normal pathway, but extravasate instead. The main types of jaundice are yang jaundice and yin jaundice, depending on whether heat or cold is involved. Causative agent may be especially potent and invade the nutritive and the blood levels. In that case, the jaundice is known as acute jaundice. And yang jaundice is the most common. Exogenous pathogenic evil. Exogenous heat dampness and dampness in conjunction with summer heat or pestilential evil can each lodge in the middle jaw, and this will cause disturbance in the TNT functions of the spleen and stomach. Dampness and heat together steam the liver and the gallbladder, impairing their functions and forcing bile to overflow and extravasate. The overflowing bile stains the skin, the eyes, and the urine, giving them the characteristic yellow or yellow-orange color. In exogenous cold dampness, they also lodge in and obstruct the middle jaw, blocking the movement of liver and gallbladder qi and inducing bile to overflow and extravasate. Improper diet, unclean foods, irregular cycles of satiation and starvation, overindulgence in fatty or sweet foods, or overindulgence in alcohol can injure the spleen and the stomach. Failure of these organs fosters the formation of endogenous dampness, which, if allowed to accumulate and gel, may transform into heat. Endogenous dampness and heat steam the liver and the gallbladder, leading to jaundice as before. Deficiency cold in the spleen and the stomach. In chronic weakness of the spleen and the stomach, excessive fatigue with exhaustion, or following injury by another illness, endogenous cold can form readily and further transform into dampness. Cold and dampness can readily obstruct the middle jaw and block the normal flow of bile. Food retention. Protracted food retention can lead to blood stasis, which in turn can cause blockage of the bile tract and force bile to extravasate and flow abnormally. Mechanical obstruction of the bile tract by gallstones or ascarid worms can force bile to extravasate and flow abnormally. Gallstones often form from protracted action of dampness and heat. Thank you very much. Now we go to signs and symptoms. Let's call on Ma'am Vina Pascua again for the presentation. Good afternoon po ulit, Ma'am Vina.
Good afternoon, Doctor. Good afternoon po sa lahat. So, signs and symptoms po tayo. Day 19, dry eyes naman po tayo na yan. Excuse me. Sa dry eyes po, ang most common causes po ng dry eyes are severe liver blood deficiency or liver yin deficiency. In the elderly, dry eyes are often due to liver and kidney yin deficiency. In some cases naman, lung yin deficiency is also involved. Dry eyes with acute onset may be due to invasion of wind heat, in which case they would also be pula po. The next naman ay empty. Liver yin deficiency, dry eyes, blurred vision, floaters, dizziness, numbness, or tingling of the limbs. Scanty po yung menstruation. Ang complexion po ay dull pale but red cheekbones. Withered and brittle nails, dry skin, and tsaka yung buhok. Paggabi pinagpapawisan, normal colored naman po yung dila na walang coating. So, ang pulso po ay fine or floating. Ang acupuncture point na ginamit ay liver 8, stomach 36, spleen 6, ren 4, kidney 6, at saka LI 4. Then next po ay kidney yin deficiency. So, dry eyes, blurred vision, floaters, dizziness, tinnitus, hardness of hearing, poor memory, night sweating, vertigo, dry mouth at throat sa gabi, at masakit din ang likod sa lower back, constipation, dark scanty urine, tiredness, lassitude. Ang kulay po naman ng dila ay normal without coating at fluting empty pulse. Ang ginamit po dito na acupuncture point ay kidney 3, REN 4, bladder 23, spleen 6, REN 12, at saka kidney 6. Pag full naman po tayo sa full. Excuse me. Liver 5. Dry and red eyes without burning sensation, bloodshot eyes, painful eyes, headache, red face, dizziness, tinnitus, irritability, a propensity to outburst of anger, thirst, bitter taste, constipation, dark urine. Ang dila po ay pula, pero mas mapula sa sides, at saka dry yellow coating. Ang pulso po ay wiry, rapid. And then, ang ginamit po dito na acupuncture points ay liver 2, liver 11, LI4, spleen 6, at saka kidney 6 po. Then punta tayo sa other patterns. Heart Yin Deficiency. Dry eyes, palpitations, insomnia, dream, disturbed sleep, poor memory, anxiety, propensity to be startled, mental restlessness, uneasiness. So, nakakaramdam siya na mainit and bothered, dry mouth and throat, night sweating, normal colored po yung dila, pero walang coating, or kaya with roadless coating. Fluting empty pulse, especially sa leaf front position. Then next, severe liver blood deficiency. Dry eyes, blurred vision, floaters, dizziness, numbness, or tingling of the limbs, scanty menstruation, dull pale complexion, pale and thin tongue with a very pale or parang orange po sa sides, choppy or fine pulse. Then ang last po ay lung and kidney yin deficiency. Dry eyes, blurred vision, floaters. So yung ubo dry din, that is worse in the evening. Dry throat and mouth, thin body, breathlessness on exertion, lower back ache, night sweating, dizziness, tinnitus, hindi rin siya makarinig ng maayos, scanty urination, normal colored tongue without coating, at ang puso po ay floating empty. So, yan lang po. Thank you, Doctor. Thank you sa lahat.
Thank you very much, Ma'am Vina. We now go to the last presentation. Still on BPH. Let's have Ma'am Teresita for the presentation. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Now let's talk about on Western medicine on benign prostatic hyperplasia. Benign prostatic enlargement occurs most often in men older than 60 years. Such enlargement is much less common in Asian individuals. It is unknown in eunuchs. The etiology of the condition is unknown. Microscopically, hyperplasia affects the glandular and connective tissue elements of the prostate. Enlargement of the gland stretches and distorts the urethra, obstructing bladder outflow. The bladder musculature hypertrophies so that a higher than usual pressure is generated within the bladder in order to overcome the obstruction and allow voiding of urine. Bands of muscle fiber are seen at cystoscopy or tuberculation. So this is an illustration on how benign prostate hyperplasia develops, okay? Eventually, the bladder becomes dilated and the muscle hypotonic. The sphincter mechanism at the vesico-ureteric junction may be impaired and reflux of urine from the bladder into the ureters and upper urinary tract may occur. So the clinical features of BPH are as follows. Frequency of urination, nocturia, difficulty or delay in initiating urination, reduced forcefulness of the urinary stream, post-void dribbling, suprapubic pain, acute retention of urine or retention with overflow incontinence, and occasionally hematuria. Abdominal examination for bladder enlargement together with rectal examination are essential. A benign prostate feels smooth. An accurate impression of prostatic size cannot be obtained on rectal examination only. So investigations should include urine culture, assessment of renal function by measuring serum urea and creatinine concentrations, measurement of PSA markedly raised in prostatic cancer, and renal ultrasonography to define whether upper tract dilatation is present. Excretion urography is not usually necessary, okay? So the completeness of bladder emptying after an act of voiding can be assessed by ultrasonography or by inspection of the after voiding radiograph carried out during excretion urography if this is performed. Cystourethropy is essential only in patients with hematuria. Treatment choices for BPH include watchful waiting. If the symptoms are not troubling, it may be advisable to wait before starting any treatment. In that case, regular checkups are necessary to make sure the condition does not get worse, okay? Now, alpha blockers, some generic names are doxazosine, terazosin, relax muscles near the prostate and ease symptoms. Side effects may include headaches, dizziness, or feeling lightheaded or tired. Finasteride is a competitive inhibitor of 5A reductase, which is the enzyme involved in the conversion of testosterone to dihydrotestosterone, the androgen primarily responsible for prostatic growth and enlargement. Finasteride decreases prostatic volume in an increase in urine flow. Side effects of this medication can include diminished interest in sex and problems with erection or ejaculation. Okay? Surgery can relieve symptoms but may cause complications. In addition, it does not protect against prostate cancer. Deterioration in renal function or the development of upper tract dilatation requires surgery. Transurethral resection is usually successful unless the gland is very large. It carries a lower morbidity and mortality with a shorter stay in hospital than open prostatectomy. Microwave hyperthermia, balloon dilatation, and prostatic stents are all being tried, but evidence from long-term randomized prospective controlled trials is not yet available. Very large glands require open transvesical prostatectomy. In acute retention or retention with overflow, the first priorities are to relieve pain and to establish urethral catheter drainage. If urethral catheterization is impossible, suprapubic catheter drainage should be carried out. The choice of further management is then between immediate prostatectomy, a period of catheter drainage followed by prostatectomy, or the acceptance of a permanent indwelling suprapubic or urethral catheter. Red flags in Western medicine. Significant symptoms from benign prostatic hyperplasia alone are not sufficient to exclude other diseases. Instrumental assessment, transrectal ultrasound with total prostate specific antigen and free PSA tests are therefore mandatory to make a diagnosis. One of the most frequently encountered acute complications of BPH is acute urinary retention. The patient cannot urinate, presents with suprapubic acute pain, and a palpable mass above the pubic bone. This condition requires urgent treatment. Okay? Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. With that, we would like to thank everyone for joining our webinar, and special thanks to all the presenters.
Thank you po, Doc.
Thank you po. See you again next week.
Thank you po.
Ito po.
Thank you po. Good afternoon, everyone.